My biggest advice is get as much exposure as you possibly can.
Yep.
I think grades are not a reflection of knowledge. Grades are obviously important. It's important to have good grades, but to me, having hands-on experience and exposure to this profession is significantly more valuable than anything on paper. I think if you want to get into this field, it's important to really know what you're getting yourself into. We're not like any other part of medicine. It's a very unique field. So if this is something you're truly exploring and thinking about, you need to get as much hands-on experience as possible and don't quit.
Welcome to the People of Pathology podcast. I'm Dennis Strang. On this podcast, we explore pathology, laboratory medicine, and forensic science. Today is Pathologist Assistance Day, and we're marking the occasion with a conversation that reflects on where we've been and where we're heading. Joining me for the third year in a row is Marissa Spencer, a fellow PA and someone who's witnessed, just like I have, the evolution of our profession. From shifts in technology to the growing recognition of PAs in education and forensics, we're talking about the progress we've seen and the future we're building. So let's get into this PA Day episode with Marissa Spencer. We hit upon the idea of talking about the history of the profession as far as where our experience with it obviously goes much farther back than either of us. But I want to start with the evolution of the PA education and training, because that's kind of what we were talking about before we started recording. So let's continue with that. Now, you were saying that even though each program, they're required to teach the students the same types of things, they do it in different ways.
Definitely, definitely. And it's funny because you were mentioning that I believe, were like an OJT
Yeah,
style PA, right?
right.
Yeah. So my mentor before I went to PA school was also an OJT. And truly, I mean, he was so knowledgeable and passionate and taught me so much. I mean, really is the main reason that I wanted to pursue this profession.
Hmm.
So there's lots of different ways. I know that's now a retired way of learning, but
Yeah.
all the programs, they have specific curriculum requirements as far as topics, but the way in which those topics are taught are at the discretion of the program. So every program's a little bit different. Like, for example, when I was looking at PA schools, the program I went to specifically was the only one, to my knowledge at the time, that actually had hands-on gross prosection during the first year. There was a lab with animal organs,
Okay.
and I remember saying, "I absolutely wanna go to that program," because in my head, I said, "How can I possibly go and apply this knowledge to real patients prior to having some sort of hands-on experience?" And then when I taught at a program, we were one of the only programs to be doing that. We also did it at that program, and now I know there are a couple that are doing more hands-on experience with practice animal organs during first year. So even in my short time, things have changed, and like I said, every program's a little bit different. It's interesting because now that I've been a preceptor for 6 different programs, you really see that. You have to kind of even check yourself and say, "Okay," for each student, I make my teaching individualized and ask them, "Okay, what's been your experience so far? What have you grown so far?" And I have them show me, even if it's something simple like a gallbladder,
Hmm.
I'll watch them do their first one to make sure that they really are doing it to the highest standard possible and making sure they're thoroughly sectioning through it and things like that, because every program is a little bit different. So I think regardless of where someone came with their learning or their education, you still wanna make sure that you're kind of watching them and doing things the way that you think are the best for standard for high quality patient care.
Yeah, for sure. And I like what you're saying about personalizing your approach to each student, which I think is, I'm not certainly not an expert in education theory, but it seems like that's a more modern approach to education.
Yeah, I think so. I mean, I'm a big believer that if somebody is not understanding what I'm teaching them, that's not a them problem, that's a me problem. I need to find a way to communicate effectively, because I can say the same thing the same way 10 times. If they're clearly not getting it on try number 2 or 3, there's a very good chance it's not them. It's
Uh-huh.
me. I need to find a different way to say it. So,
Right.
and even styles of teaching. Some people really like direct feedback to their face. Some people don't. They want it in written form, or some people want to be checked in on throughout the case, or maybe they need that and they don't even realize they do. And then some people, you kind of check in with them at the beginning, somewhere in the middle, and then at the very end.
Hmm.
It really just depends on the person. I think it's important that you don't just kind of give black and white rules when you're teaching, that you really have to find the gray. And assess every single situation and person individually.
Okay, I like that, and I'm gonna have to write that down because, like I told you before we started recording, I'm gonna be a preceptor coming up in a couple of months for my first time.
It's going to
So
be incredible. You're going to love it. I've been a preceptor for the last, gosh, I think 8 years now. Yeah, 8 years. And
okay,
it is truly the most rewarding, fulfilling component of my job, teaching PA students, because they're the future of our profession. You're paying it forward. And those light bulb moments when they're making connections and really understanding the impact that they're going to have on their patients and on the future of the profession,
right,
it's so meaningful. It's just really special. And I wouldn't say I'm an expert because there's so many people who teach and they've been doing it for even longer than I have. But I really do think that I've grown a lot in those 8 years as an educator. And I feel like I've changed a lot in those last 8 years. And my approach has definitely changed because I'm realizing what really works best. And I think approaching each person as an individual and each specimen as an individual really is the best way to go about it. I mean, even think about it. If you think about a uterus for leiomyomas,
uh-huh,
on paper, that sounds the same, but I could have one that's 100 grams and you could have one that's 400 grams. And the length of time you take to gross it's going to be different. How many sections you submit might be different. So it's each specimen should be handled, I think, individually, and each interaction with a specimen for a student, you might have to handle a little bit more individually or differently. And it's good to, I think, have that mindset when you're teaching.
okay. Even though I haven't done this yet, I've over the last probably 2 or 3 years, I've made myself more available for shadowing of prospective students, and it's you're not exactly teaching them, but you are showing them what the job is. And I
Mhm.
find myself like, okay, I have to know, first of all, I have to know what I'm talking about. Right.
Yeah. It could be intimidating because of that, right? You feel
Yeah.
like on the spot, but I'm a big believer the best way to show like, if as far as, like, learning goes, when I was teaching students, I'd say, if you can teach somebody else something, you really know it backwards and forwards.
Yeah.
And Dennis, you've been a PA for so long. Of course, you know what you're doing backwards and forwards. You just have to find the words to say that and share that. And that is really what's the challenge, right? You might physically be capable of doing the job, but physically actually grossing or doing things beyond the bench is very different than teaching somebody how to do those things.
Hmm.
And I remember when I first started teaching I was very much like a step teacher. I'd be like, "Okay, first we're gonna measure, then we're gonna cut, then we're" and I realized you have to change that approach because telling somebody a list of steps is not really that meaningful. It's like you're memorizing things. And now when I teach, I'm always teaching why you're doing what you're doing, which I know we've talked about in the past when I came on the podcast.
Yeah.
I'll say like, okay, remember, we're going to longitudinally section the tip. Why are we doing that? Like ask questions while I'm grossing. I really want them to answer. And some students I can tell that intimidates them and puts them on the spot. But if they're like, oh, I'm looking for a carcinoid tumor, that's something I could find incidentally in the tip of the appendix. I'm like, that's right. Excellent. So now they're preparing for their boards because that's questions that might come up. They're sectioning the specimen correctly, and they're actually acknowledging why they're doing it that way.
Yeah.
And even as a teacher, there are some things that are ingrained in your brain. You've been doing it that way for a decade of time. When you have students, it's a good refresher for you too, to be like, gee, I know I have to section this like this. I don't even remember why I'm doing that. And then you have to check yourself. That's made me such a stronger grosser just teaching because I feel like I really see things from a different perspective. I'm not just teaching from like a pro section perspective of a checklist. I'm thinking more full circle. How is this going to impact the patient? How is it going to impact their diagnosis, the prognosis, things like that?
I remember you brought that up the last time you were on a year ago, and I I thought about that a lot, and I put that into practice. I mean, we have residents where I work, so I try to do that with them rather than telling them what to do. It's
Mhm.
what do you think you should do, and then all right, why? And I even do that with some of our lab assistants. Like they'll ask, okay, this specimen is weird. How should I order this? Whatever, and it's like, all right, how do you think you should order it, and then why? Right? I feel like that helps you. I think it helps you learn better and it helps you remember things more when you know why you're doing the things you're doing.
1,000%. I could
Yeah.
not agree more. And it's, I think at first when you're teaching that way, some people can be off put by that as a learner. They
Yeah.
can feel like you're putting them on the spot or you're trying to fluff your own feathers in some way. And
Mm.
that's not it at all. So I think it's all about your demeanor, about how you're approaching those things. And like I said, you're just such a calm, level-headed guy. You're gonna be a
Oh, yeah?
preceptor because you know what I mean? Like, you have, like, a good tone, and when you ask those questions, that will come off great to that student. They will not feel, hopefully, as intimidated as they could in a different tone.
Mhm.
Yeah, I always just try to feel very welcoming and open when I ask those types of questions and not,
Yeah.
like, accusatory or making them feel insecure. I want them to know, "Hey, like, you know this. Great job. You knew it." And if they don't know it, it's okay. They're gonna learn it. That's why they're there.
Right.
So, it's great that you're doing that now, and I think you're really gonna see the benefit of that when you're teaching your students when they rotate with you.
I think so too. I'm very excited about it, actually. Speaking of that, I mean, the program that I'll be a preceptor for is new, and I
Mhm.
wanted to get I mean, I have my thoughts on this, but I wanna get your thoughts on this. There are more training programs now, certainly from when both of us started. Do
Absolutely.
you think this is a good
Definitely.
thing?
Absolutely, I do.
Okay.
For both of us, it's been some time, you even longer than me. When I first learned about the profession, there was maybe half of the number of schools that there are now in the
Yeah.
United States, and it was such a small field, people had no idea what I was talking about, they always thought it was something like forensic science related,
Mhm.
CSI kind of thing. That still is definitely a misconceived perception, and it's still a very small field, but I love that it's growing and expanding. The reality is there is a need for PAs. The evolution of medicine is constantly happening, and the more things that are happening beyond the bench for pathologists, there's a more need for PAs in the gross room and beyond. There's so many things that we can do with this degree. So I think it's actually a great thing to have multiple programs, especially because when you look at a map of where the programs are, there are a lot in very similar portions of the country. Like, there's a ton in the Northeast when you think about it.
Yeah.
There's not a ton in the middle of the country or in the South. So, the more programs that open up, the more opportunities for individuals to go to these schools, obtain this degree, and then work. The reality is, it's not like there's not hospitals in the South. There are just a lot of on the job trained people in the South. And because that's really kind of going out of existence, if there are opportunities for people to go to school in the South, then they can actually attend a program, graduate, and then apply to a job that's close to home for them. 'Cause I do think that is something that inhibits people currently is if you, let's say you live, I don't know, in New York. There is a new program in New York right now,
Yeah.
but the next closest one's in Connecticut, and beyond that, it's probably Pennsylvania. And if you have a family or your whatever your situation is, you might not be able to move. So it would limit or inhibit somebody from actually attending a program. So I think the more programs, the better, because the more people we put out into the profession that are adequately trained, the better.
Yeah. I've heard people say things like it's gonna saturate the market and there won't be enough jobs or the pay is gonna go down and all those things. And I disagree with all of that stuff. I mean, you can look at the AAPA has a job
Mhm.
board, right?
Yeah,
There's some people advertise on Indeed and things like that, and there's new jobs all the time, all over the country, and then
absolutely.
the pay is good. I think it keeps getting better, at least in my experience. And I disagree with all that stuff, and I think that as a field we're still not unknown, but relatively compared to say comparable positions in other fields, we're still relatively unknown. And part of that, I think, is that we just don't have enough numbers
Yeah.
to make enough noise to be known. You know what I mean?
Absolutely. Oh, I agree. I mean, because we're highly specialized
Yeah.
in pathology, we're only working in pathology
Yeah.
and we're not patient facing. So that makes things challenging because the patients we're serving really have no idea what pathology is or where that plays a role in their care. And then even the clinicians that we work with, surgeons, oncologists, radiologists, they're not super familiar with what it is that we're doing either. So it absolutely can kind of inhibit growth or acknowledgement or recognition if there's that misunderstanding. So I think the more programs, the better, because that allows people to kind of come in. I also agree with you. Every single week, somebody is asking me about a job
Right.
on LinkedIn or the AAPA, a friend of mine, and I have no intention of leaving my job, but it just shows that there are absolutely positions everywhere. There's a need for us, and not just in surgical pathology, but in autopsy pathology and forensics. We're finally being seen as a great resource and tool that can be utilized. And that's wonderful because there are so many PAs who want to break into that field. And beyond the bench, there's so many things that we can do with research and other jobs. I've actually seen, I don't know if you've seen this, especially up in the Northeast, I've seen a couple of jobs now posting for other areas in pathology where slide preview is part
Oh,
of
yeah.
the role for PAs. And I think that's huge because we have to learn that. It's part of our boards. And I think that that's totally an appropriate place for PAs to be, especially if there's a need. If there's a need for that, we can fill that need.
Mhm.
So I think the more PAs schools, the better.
Right. There's definitely a need for us. I mean, it's pretty well known that there's a shortage of pathologists and
Hmm.
an even bigger shortage of forensic pathologists. So we're able to fill some of those gaps. So let's get into the forensic pathology part of it that you
Hmm.
mentioned. And this is a bit maybe controversial, I guess, still.
It
Um,
is.
and I know I was previously on the AAPA board of trustees and it was starting to be talked about then. And you currently are part of the board,
I am.
right? So what can we say about this? Like, it's that PAs in forensics is starting to be more accepted a little bit, maybe?
I would say yes. It's interesting when you think about where we've been and where we're going as a profession. We've kind of always been told in some capacity that we don't have space there or we don't belong there when it
Uh-huh.
comes to things beyond prosection and surgical pathology. You know, residency education, which we can go back to at some point.
Yeah.
I remember when I first started like 10 or maybe 8 years ago, I very, very vividly remember being at the AAPA booth at a conference where I was representing the profession and having a pathologist tell me to my face that she felt PA should not be training residents and that residents alone should be training residents. And I was so taken aback that this woman said this directly to me, but that was actually a very widely felt belief.
Yeah.
And now that's totally changed. So I feel like forensics is kind of similar. The reality is we do not have enough forensic pathologists and we have a lot of PAs who are very interested in forensics.
Mhm.
That being said, I do think one of the most important things we have to consider as a profession, more so, I guess, as individuals, is knowing your limitations. Because all programs do have training in autopsy, whether that be more forensics focused, medically focused, or a combination of the two. That does not mean that you can just graduate and start working in a forensic setting and know exactly what you're doing. It's very different from surgical pathology, where most programs prepare you pretty well to, on day one, be rocking and rolling in the gross room.
Mhm.
So I think if you're a PA who's interested in going into forensics, you have to set clear expectations with whoever is hiring you that this is something you want to do, you're passionate about, you have knowledge about, but that you do need to have more in-depth training than like surgical pathology. And I think recognizing your own limitations would be really important. But I do know, I mean, two of my students that I taught at a past program both work in forensics full time. That is their career. They do everything from eviscerating to section submission to writing of the PAD, previewing slides, the external exam, of course. They're doing a ton with their role. They also work intimately with their pathologist, and there's a lot of trust that's built there through very in-depth training to get to that point. So I think that it's a possibility. I think it's going to continue to grow. I think we're going to start seeing PAs be more accepted in the field of forensics, but I do think that there needs to be clear communication about people's levels of comfortability and also their level of training and competency
Yeah.
if you're going to take a job like that.
Yeah, for sure. That's something that I like to tell people that come in and shadow me because I try to go through not only what I'm doing, which is pretty much all I do, most of what I do is grossing, but I like to
Mhm.
kind of go through these are some other areas that PAs are getting into. And I always mention forensics, but I tell them if you're getting into this field just to get into forensics, it's not there yet, right? There's
Right.
still probably, I don't know, 5 years or so before I think that's going to become more the norm. But I like what you're saying. It's the role of the PA has to be very clearly defined, and the trust
Definitely.
between the PA and the pathologist has to be there too, which takes some time to build.
Absolutely. One of the people that I know about, which I'll have to connect you, maybe one of them will come on here and talk to you.
Oh,
I
absolutely.
One of them, she had worked in the medical examiner office prior to going to PA school. That was actually part of why she went to PA school, because she knew she wanted to come back and work there as a PA. And so she's had a long relationship with that medical examiner office. The other one, she did her rotation there. They loved her. She loved it there and ended up going there after graduation and
Okay.
has been there ever since. And rotating there as a student, that was the first time they had PAs ever at that medical examiner office. And they were just so impressed by the level of knowledge that PAs had. And I think that's actually a big issue, I think, with our profession, because since the programs are so vaguely defined as far as what is exactly taught, it's more of like a categorization than a real checklist of things.
Hmm.
Everyone's level of knowledge is a little bit different and everyone's training is different. And because it's a small field, our voice and our actions in the grocery room and beyond actually really are relevant, because that might be the only interaction that somebody has had with a PA. And if it's a poor interaction, it can tarnish what you think a PA is capable of doing or what your expectations of PAs are. I think sometimes when people like pathologists think PAs don't belong in forensics, maybe their experiences with PAs in the past weren't as great as they could have been
Mm.
for whatever reason, maybe lack of experience, knowledge, etc. Because when pathologists have worked with competent PAs who are passionate, engaged, and really know their anatomy, prosection techniques, etc., they're thrilled to work alongside them because they trust them. They've seen the work that they do, they know they're knowledgeable, and they respect their level of knowledge. So I really think some of that can kind of play a role in why people think we belong in certain areas versus others.
Yeah, for sure. And it's like you're saying, if they had a bad experience or a bad impression of a PA, it's really hard to change that after that
Yeah,
happens.
absolutely it is. And I mean, I know, for example, because I work in surgical pathology and autopsy pathology, but mostly surg path.
Hmm.
We have fellows come through, they do their residency elsewhere most of the time. And I've had multiple jobs where I can see that maybe PAs didn't play a big role in their training at that institution. So they don't really know the level of knowledge or expertise or comfortability at prosection of a PA. Some they're doing their fellowship, they're kind of surprised by that level of knowledge. And
Yeah.
I have to remind myself every time this might be their very first experience working with a PA or working with a PA at cancer center or whatever it may be. Because yeah, if their experience was different before, they really don't know what the scope of practice of a PA actually is.
Hmm.
Especially if you're someone working at like a small community hospital, you might not have a ton of complex cancer cases, you might not have autopsies. So what the PA is doing day to day might look very different at that hospital than a very large academic institution where they have complex cases out the wazoo, molecular, research-based things, frozens, autopsies, teaching, management, whatever it may be. So your perception of what a PA scope of practice is, I think, is sometimes limited to what your experience with a PA is. And I
Right.
think that really is what's been inhibiting PAs from expanding in other ways within the field.
Yeah.
I also think that fear, I think for the most part, and I'm speaking in just my own experience.
Right.
This is my own personal feeling. I think the fear that PAs are going to take over pathologists' jobs has mostly gone away because that's not what we want to do. PAs don't want to become pathologists.
Right.
They want to work hand in hand with them. So I think that fear has mostly gone away, and it's more just a lack of understanding of what a PA is actually capable of.
Yeah, I agree with that. I mean, it certainly when I started, there was still a little bit of that, but nowadays it seems like, I mean, you've got a generation or probably two of pathologists who have always worked with PAs,
Oh, yeah,
right? And so,
absolutely.
and though even the attitude of PA shouldn't be training residents has definitely changed. And some pathologists only want PAs to be training residents in grossing.
Definitely. I remember when I was a student, residents, like chief residents, were really mostly responsible for training residents, and they would ask PAs questions from time to time, but it was more like a resident to resident training.
Okay.
Now the expectation is, for every job I've had at least, yes, the PAs are the experts in the gross room. That is who is responsible for education in the gross room. That's your go-to person. And I think that that's great. I think it shows a level of appreciation and respect for the training that we have. And it also just really encourages interprofessionalism. I think that medicine is very collaborative, especially nowadays. And it's so funny because I think when people think of pathology, Since we aren't patient facing, I like to think most people assume that we're all introverted, we don't interact with people, but I actually think it's quite the opposite because as a PA, you're interacting with residents, pathologists, techs, surgeons, radiologists, oncologists, nurses. So many people have to come together and collaborate to give patient care in pathology. So I think it's really great for residents to learn from PAs because it helps them strengthen their own skill set and develop interprofessional skills and learn about the profession, learn about PAs, what their training is like. And I think it's very valuable to them to see that and also just really gain that knowledge in the gross room because the reality is, if you don't understand it at the bench, you're not going to understand it at the scope. And I think, unfortunately, in some ways, because we are so heavily used in the gross room and pathologists are less and less in the gross room, there is a little bit of a change of perception of the value of grossing for residents,
Yeah.
and I that is a little concerning sometimes because I've had residents say to me in more recent years, "Oh, I'll just see that at the scope. I don't need to figure that out." And I say to them in return, "How are you going to see that at the scope if you don't know to section it here?
Right.
If you don't take the section in the gross room, it's not gonna make it to the scope." And the reality is that most people, I think, respect the work of PAs and appreciate their PAs, but there are some people who I think maybe devalue gross pro section. They think it's not as important. And if in training you have that perception, that concerns me for the future because the reality is our job is to sample things appropriately so that the pathologist can correctly sign out a case.
Hmm.
So if you miss something at the gross bench, there's no way for the pathologist to know that you missed it. So
Right.
they could misdiagnose or misstage a case easily if we aren't doing our jobs correctly. So my big concern, I guess, with training residents sometimes, not always, is that if they don't see the value in gross pro section or they don't really know what they're doing in the gross room and they just assume, oh, whatever, it doesn't matter. This is a PA's job, not mine. I'm just doing this for training. Well, that's how mistakes can happen. That's how mistakes can be made sometimes. And that is a concern I have about the future of the profession sometimes.
Yeah, that's a tricky one because I mean, I've worked with residents for 7 years now, and there's so many other areas that they need to focus on that grossing is kind of the last place a lot of times. But at the same time, they know that probably wherever they go after residency, there's going to be a PA or a few there, and they won't have to gross anyways. So it's like it for us as PAs, it's more I get job security, I guess, for us, because we
Hmm.
know that these to be attending pathologists are not going to be as competent as we are in grossing. Grossing only is all I'm talking about. So it's more job security for us, but at the same time, they still need to have that understanding. Like I try to think about it as they don't need to be as competent as a PA in grossing, but they do need to understand what grossing is, how it works, and how like they need to read a gross description and know what we did, how we sectioned it, and why. All of those things. Yeah.
Absolutely. And I think sometimes because it's becoming labeled as quote PA work,
Yeah.
which, I really hate when I've heard that before, that term, and I really hate that because number one, I feel like it's disrespectful. There's some sort of hierarchy that people have in their head, and I'm a big believer that
Mhm.
regardless of what letters are after your name, your role in patient care is crucial, and we all work together collaboratively to provide the best quality care that we can to our patients. And I feel like that's really important when we're teaching, especially residents, for
Yeah.
them to understand is that regardless of what your role in the lab is in your head, everybody's at an even playing field when it comes to patient care because everybody is doing something that's critical and important for that patient's care to happen correctly and appropriately. And yeah, I think it's important that they know why things are done in the gross room, how they're done, why the sections are submitted. And if I hear them say, "Well, I'm not going to do that when I graduate. I'm not going to do that. I'm not," or even if they say, "I'm not going to be in surgical pathology,"
Mhm.
I say, "Okay, well, it's still important. It's a crucial part of patient care. And if somebody was to ask you as a pathologist, as an attending, a question about this, would you be able to answer it? And if the answer is no, I say, right. So that's why it's important you learn it. You have to still have some sort of base level knowledge of prosection. Like you said, the foundational things
Yeah.
is so important for them to understand. So I really try to encourage them and remind them that if you don't get it at the bench, you're not going to see it at the scope. So it's really important you understand what you're looking for here.
Hmm.
Yeah,
Yeah. And this goes back to what you were talking about earlier about interprofessionalism, because and making a good impression, because these residents, they're going to go on to become pathologists, and some of them are going to be the ones in the CAP or ASCP or whatever organization who are making decisions about the utilization of PAs. So I think it's important to make a good impression with these residents early in their career. So they go wherever they go, and they're like, should we be utilizing PAs more? And they're going to go, yeah, PAs are great. I loved my experience with them.
exactly. Yeah, exactly. And I think for the most part, residents really do have a great experience with PAs. They
Yeah.
appreciate their PAs. I feel very fortunate. It's truly such a rewarding part of my job. If someone was to ask me what's your favorite part of your job, I'd say probably the teaching component because I think it's great to see those light bulb moments. It's just different for residents because at the end of the day, like I said, many of them are appreciative of the work that you're doing and they see the value and they're grateful. But a lot of them know I'm not going to do this in practice. So some of them, whether you're the best teacher in the world or not, the material might go in one ear and out the other for some of them,
Yeah.
basically. Versus PA students, this is their future. This is their career. So
Yeah.
everything that you're telling them, they're really absorbing like a sponge and they're utilizing it. And it's just so great to see their growth, making those connections, and even seeing their speed and efficiency increase is just so rewarding and fun. Yeah, it's great to be contributing towards the future of the profession of PAs and just pathology overall. And I think you're right. There is job security for PAs because the reality is tissue is the gold standard. That's not going to change.
Hmm.
And you're always going to need somebody who can competently assess the tissue so it can be submitted appropriately for histologic assessment.
Hmm. This is the People of Pathology podcast with our guest, Marissa Spencer. We'll be right back. LabVine is an interactive online learning platform where laboratory professionals learn, develop, and discover by sharing knowledge and building on each other's experience. The platform provides global access to internationally accredited laboratory-specific courses and other resources developed by lab specialists like us for the laboratory industry. LabVine is free to sign up, and you can use the link in the show notes to get started. If you think it would be nice to have a helpful reference about digital pathology, I have some great news for you. Dr. Alexander Zhurov has written a book called Digital Pathology 101. All you need to know to start and continue your digital pathology journey. This book will help you whether you're a complete novice or a digital pathology trailblazer. You can get a copy of it by following the link in the show notes. Now for the rest of this special PA Day episode with Marissa Spencer on the People of Pathology podcast. Let's get back to the expanding role of the PA. I mean, we touched on teaching quite a bit. We touched on the forensic aspect of it. There's other areas too. I mean, tissue banking is one that I think PAs are being more utilized there. What do you think about that one?
Oh, that's great. I've been so fortunate. I have done tissue banking in every job that I've had in the last 10 years. I think that's a huge, important part of the profession, honestly, and that more PAs should be utilized for that. Whether you're banking for patients individually, like their own individualized care, or you're banking for some sort of research project for that tumor type that might help patients down the road.
Yeah.
It's really great to utilize a PA in that situation because the reality is PAs know what's normal tissue versus abnormal tissue. So when they're sampling for controls for normal and controls for tumor, they know how to do that. When you're banking tissue, you have to know what's relevant for staging. You don't want to take something that's going to potentially compromise the staging of that individualized patient. That patient always is going to come first before this research.
Yeah.
So using a PA in that situation is hugely beneficial because we know what's necessary for signing out this case. We know what's on that CAP checklist. We know what we're looking for when we're sampling tissue. And we know what is not as relevant that's appropriate to be sampling for tissue banking for research.
Yep.
Yeah, so I hope that more PAs are utilized in that way. And truthfully, it's not something that's super time consuming depending on what level of involvement you're in. There are a lot of techs who actually, separate that tissue out and submit it off to whatever studies are being utilized. And really, PAs are more so being utilized to just select the tissue and sample it.
Hmm.
And that only takes a few minutes. It's really not a challenging part of the job. It's not like it's going to inhibit your workflow. So I think any person that's ever asked me, like students, when they're asking about a job and they say there's biobanking, do you think that'll be hard? Or do you think, that's something I should consider or not consider? I think it's a great opportunity. It's also good to do biobanking just to see what tissue looks like normal, like fresh versus fixed, especially when you're a newer grad. It's so helpful to see a tumor or normal parenchyma when it's fresh versus once formalin has penetrated it and kind of changed the colors of it.
Yeah, and I think you mentioned that the last time too about really having a good idea of what's normal before you can understand what's abnormal. Yeah.
Yeah, definitely. That's why autopsy is so great. I love
Hmm.
medical autopsy. I tell people all the time, doing an autopsy and seeing inter-organ relationships, hugely beneficial to understanding staging and what things should look like in the body, and also just what normal anatomy looks like.
Yeah.
That's another thing that I think PA could be utilized for, teaching anatomy, anatomists. I mean,
Sure. Yeah.
that's a huge thing that we're great at. I think a lot of PAs are looking for jobs beyond the bench. Eventually they burn out.
Hmm.
And one thing that they can do, I think, is teach anatomy. There's a need for that in medical schools, in undergraduate studies, other mid-level practitioners. They all need to learn anatomy. So it's a great opportunity for them.
Yeah. I absolutely agree with that. Okay. I want to end with, and this might take a little bit to talk about, but future directions of the field and starting there, talking about new technology. So I was thinking about like digital pathology, and that's starting to become more common, but it's more used for the microscopic aspect of pathology, right? It hasn't really gotten into grossing, at least not yet, but it's starting to creep in there. We're seeing more imaging, and I know of a few companies that are starting to look at this as far as like computer assisted measuring, 3D imaging, stuff like that. So how do we think that these incoming technologies are going to change what we do?
Oh, that's a great question.
Yeah.
I am not a huge believer in AI in the gross room. I don't know if you've seen that equipment, that lymph node dissector where you put the fat in this piece of equipment and it finds lymph nodes for you.
Yeah.
There are tools like that that exist, but I really think at the end of the day, prosection is a skill that takes time to master, and that if you really put the time and effort into doing your job, you do it far better than a piece of equipment ever could.
Hmm.
Think about radiology. The whole reason tissue is the gold standard is that imaging can only do so much, especially in breast. Breast is one that, it can hugely vary. You might see on imaging something that looks like a PT1, and then when you actually have it in front of you, it ends up being a T2 or even higher sometimes. And that's why we have our job. So I'm not really sure. I think it's a great tool. I think it's a great resource to have different technological advancements, but I do not think it's going to replace us by any means, because I think at
Right.
the end of the day, a human being needs to be assessing this tissue and sampling it appropriately. But I
Right.
do think it's something that can help us, just like voice recognition software that exists.
Right.
That's a hugely beneficial tool and it's a technological advancement, but it's not like, I don't know if you've ever seen online. I saw somebody had like an AI write a gross report
Yeah.
and it made absolutely no sense. I mean, it was really funny and comical, but it's not something I think is realistic because every specimen is different, every case is different. I think at the end of the day, those are helpful tools, but they're not going to replace us or take over our profession, I don't think.
Right. I agree with you. I don't think they're going to replace us ever, but I've heard some people, and I've had them on this very podcast talking about creating an AI as like a tutor or an assistant, so you can ask it questions while you're. I mean, they were talking about it in terms of like looking at a microscopic slide, but I wonder if like as you're grossing and you go, all right, this is what I see. What should I do? That kind of thing. That's probably far into the future, but I don't know. Those kind of things are interesting to me.
That's a cool perspective
Yeah.
and something to think about, definitely. It would be great if there was a tool. There are like paper tools, obviously, resources you can read to look at grossing manuals to
Hmm.
say, okay, this is what I'm seeing, what should I do? But it would be interesting to see if like an AI prototype of some sort ever existed or was created and testing that out.
Hmm.
Could it work? Could it do that? That would be really cool. One thing I can think about in technology that is helpful is like 3D printing of
Yeah.
things, especially for students. The most difficult part of teaching, especially in first year of a program, as somebody who used to work at a program, is the 3D concept of things because you're teaching in a lecture style and you're putting things in photographs, right? It's all 2D. And that third dimension concept is sometimes very, very difficult to grasp until you're actually doing it. And you go, now I get it. Those light bulb moments really happen in second year because they're actually applying the knowledge that they learned.
Hmm.
So 3D imaging, I think, would be hugely helpful because if you could have a 3D model of a larynx, for example,
Oh, yeah.
and you can put a tumor inside of it, understanding the anatomy of the larynx, the significance of where that tumor is for staging, because every location changes the staging protocol, is so helpful. That would be an incredibly useful tool for
Yeah.
that 3D concept because even like we would teach using animal organs, like kidneys, for example, are pretty easy to get. You can get them online. They're not that expensive. But the problem with that is that there's no tumor in them, right? They're
Right.
just benign kidneys. So for our students, when we would use them, they'd get the concepts of gross prosection, how to open and bivalve through the collecting system, how to take those margins. But the lesion that they would draw on with ink is what we would have them do. It would still be flat on the top. So that third dimension component, they weren't really comprehending until second year. And then they were like, oh, now I see how I can get this section to the perinephric fat in this plane, or now I see why this section matters. So a 3D printer to help demonstrate those things during student learning
Hmm.
would be a huge tool if people could get those. But I know that that's something that's expensive and takes a lot of time, my
Yeah.
understanding.
Yeah, I'm actually glad you brought that up. So I've been sort of experimenting with 3D imaging. There's some apps you can use to take 3D images, and then you can it makes a picture, but you can rotate it and zoom in and get kind of that 3D perspective. And one of our residents dabbles in 3D printing a little bit, so I'm hoping to maybe print some of those and just to see what we can do with those. So those have been interesting experiments.
That sounds incredible. That's
Yeah.
awesome. I hope that works out for you, and if it does, let me know, please, because
Hmm.
I really do think that is one bit of technology that's underutilized
Yeah.
and would be incredibly beneficial. Because, like I said, even in training programs, having those organs to practice on, awesome, but the concept of having a tumor of them can still be lost.
Yeah.
So, if you have the capability to really print something and show relationships, that'd be great. Imagine like a bladder. Doing a bladder with a 3D printer would be amazing. I feel a lot of times when I'm teaching students, the concept of the ureteral orifice and how I take that section
Oh, yeah.
can be really misunderstood, or a Whipple. Sectioning
Hmm.
that can be difficult for students to understand or residents alike. So if there was a model I could use to show them every single time, I mean, what a great resource that would be.
Yeah. Yeah. Well, I hope to make some progress in that. And I'm pretty sure other people are working on that too. And I feel like for some kind of really rare tumor or rare
Yeah,
disease, that would be so valuable because you might not see that everywhere. And then you could share that.
absolutely.
Yeah.
Definitely, especially if you work like in a I don't know, a pediatric institution, let's say, so you're not getting a ton of a specific type of tumor that's seen in adults,
Hmm.
but a student's asking you about that. If you had a resource like that just readily in your hands, that would be huge. That'd be so helpful.
Yeah.
You've got a whole year, Dennis. I'll be back next year, so
All right. Hopefully
yep,
next year,
great update.
next year we'll have an update on that. Hopefully. All right. That
Amazing.
sounds good. That sounds good. All right. So then let's end with two things. How do we, as practicing PAs, how do we want to advocate for the field? And then at the end, let's talk about maybe a little bit of advice for those trying to get into this field.
Wonderful. As far as advocating goes, truthfully, what I really think is important is volunteering. And I know
Yep.
I'm biased because I'm very involved with the AAPA. I'm on the board
Yeah.
and I'm also the committee chair for Marcom. But we are such a small profession. Your voice as an individual really matters and it impacts the future of our profession. Because as I said earlier, a resident or a pathologist's interaction with a PA really is impactful and can affect their future. If you train residents as a PA, when that resident goes off and does their fellowship and they work with PAs and then they graduate and they're going to work in surgical pathology, they'll probably be hiring PAs.
Yep.
So, advocating for yourself with everyone around you, what your scope of practice actually is, how you can be best utilized, and also saying what you want to do, what you want out of your job, ensuring that the work you're doing is based on the level of knowledge that you have. Don't be taken advantage of, but definitely utilize your skills appropriately and share them with those around you to help promote the future. Volunteering to get things out there, what you want the future of our profession to look like, helping with that would be huge. The AAPA is almost all volunteer based.
Yep.
We're all taking our time out of our busy schedules to help further advance our profession. And it doesn't take that much time. Really, it doesn't. So if people want to get involved, I think that's a great thing to do.
Right. All right. I love that. I mean, I've been a volunteer for a long time as well.
Mhm.
And I'll include a link to the AAPA if anybody needs it so they can find ways to volunteer. All right.
Yeah.
So last thing, we've got potential students coming in. What advice
Mhm.
do we have for them?
My biggest advice is get as much exposure as you possibly can.
Yep.
I think grades are not a reflection of knowledge. Grades are obviously important. It's important to have good grades, but to me, having hands-on experience and exposure to this profession is significantly more valuable than anything on paper. I think if you want to get into this field, it's important to really know what you're getting yourself into. We're not like any other part of medicine. It's a very unique field. So if this is something you're truly exploring and thinking about, you need to get as much hands-on experience as possible and don't quit because it can be difficult to find that experience. But if this is something you're passionate about, PAs are just as passionate as you and they want to share their knowledge with you. They want to give you opportunities to learn. So reach out to people. And it's also since it's a small field, like I'll be honest, if I don't have shadowing opportunities at my job, I might say, I'm so sorry we can't take you, but I know someone who can. Let me refer you to this place.
Yep.
So it's all about just really reaching out, having the courage to actually look for those opportunities. Call up local hospitals and say, I'm interested in being a PA in pathology. Can you connect me to that department and see if you can get some shadowing in? Or reach out to you, Dennis, your amazing program. Do you want to plug that really quickly?
Yeah. The Pathologist Assistant Shadowing Network,
Yeah.
which has been, I think, just under a month. And we've already helped 10, possibly 12 people find shadowing opportunities already. We definitely need more practicing PAs in the group to
Mhm.
help us expand, and there's lots of students. And this is something, the whole shadowing aspect, like I said, I've been making myself more available to do it at my job. But I've been thinking for a long time because almost every person that comes into shadow, and they're like, these opportunities are so hard to find. And I always thought, why is that so
Mhm.
difficult? How can I make that easier for people? So we started this LinkedIn group. It seems to be working, and I'd love to see it expand and help more people get into this field.
That's so fantastic. I love that. It's so
Yeah.
funny because that's to me, I think the most valuable thing you could do. And I want to do it everywhere I work,
Hmm.
but not every place will let me. There's a lot of tape I've realized to letting
Yeah.
people cut into the gross room, which is understandable. Some jobs are significantly more open to it than others. And that's hard because it might not be you personally who doesn't want a student or someone to come shadow you.
Yeah.
It might be your hospital. And I know that that's a challenge, but I think it's good to have everybody join in and try to support the future of our profession and people who want to get into this field because we were all one of those people at one point. I remember how badly I wanted to be a PA, and I was so fortunate to have the experiences that I did because I really truly believe that my hands-on experience is what set me apart when I was applying to PA school.
Yeah.
I think if I didn't have that experience, I don't know if I'd be here right now, to be honest. So I'm very grateful and I like to pay that forward as much as I can.
Right. Absolutely. And it's, again, that's rewarding because people are so thankful that you give them the opportunity or you connect them with someone else who can help them. And it's as rewarding as working with a student, working with a resident. You're changing somebody's life. And I love doing that. It's so rewarding and it's fun.
It is, it really
Yeah.
is. It brings joy to your life, and honestly, the cool thing about being a PA is that not every day is the same, but over time, even the things that aren't the same can feel kind of dull if you've been a PA for a long time. When you have a shadower, it is like a breath of fresh air because they think an appendix is the coolest thing they've ever seen in the
Yeah.
world. You should them a placenta, they're like, "Oh my gosh." I mean, they can't believe it. So, it's really fun for you too
Yep.
when you have somebody shadowing you because something that seems so mundane and norm to you, part of your every single day routine, is absolutely fascinating and thrilling to them. So it brings a lot of energy and good vibes back to you. And it reminds you, wow, my job really is so cool. And it's great to share that with that shadower, but it also is just great for yourself. I think it warms your own heart and reminds you how awesome your job really is.
Yep. Totally agree. I think that might be a good place to end. It's always fun to talk with you. I'm looking forward to doing this again next year. Marissa Spencer,
Um,
thank you so
Thank
much.
you so much. Thanks, Dennis. It's always so fun to chat with you. Yes, I'll see you next year in
All
April.
right, sounds good. If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from the last time Marissa was on the podcast as we talk about improving pathology education.
And if you understand why you're doing what you're doing, then in conjunction with the anatomy of the specimen, you really do have a lot of resources and tools readily available to you to approach a case. Half the battle is being able to orient the specimen and identify what you have, and the other half is getting the information that's important for the pathologist, right? So when we're grossing, we're not just diagnosing tissue or tumors, we're also assessing the surgery, right? Was it complete? How far are the margins? Did they get everything that they needed? We're looking at the stage, histologically, they're going to be assessing the grade of the tumor. So there's a lot of things that go into that assessment, both grossly and histologically. And if you can appreciate that, then even if you've never seen something, I think you have the tools to be able to approach it.
You can hear more of that conversation in episode 179. All right, big thanks to Marissa Spencer. It's always fun to chat with her. The medical world is constantly evolving, and with it, the role of pathologist assistants is expanding in exciting ways. We talked about how PA education has evolved over the years. While each program is tasked with teaching the same core subjects, they have the flexibility to adapt their teaching methods. This has led to a diversity of learning experiences, highlighting the personalized approach to education that modern programs are adopting. Marissa mentioned how her 8 years as a preceptor has been some of the most rewarding of her career, underscoring the importance of PAs in training future professionals. She stressed that effective communication is key to this process. If a student doesn't understand something, it's up to the educator to find an alternative way to teach. This personalized approach is becoming more prevalent and is essential for molding well-educated and adaptable PAs. While the traditional role of a PA has primarily been surgical pathology and grossing, the role is expanding into other areas such as teaching residents, biobanking, and even forensics. We talked about each of these areas a bit, particularly forensics. Right now, there's only a small number of PAs working full-time in this area, but there does seem to be a need for us, and with additional focused training and relationship building, there are some real opportunities there. It will be interesting to see how this evolves. As more training programs emerge, there is some concern about market saturation. But Marissa and I both see this growth as a positive development. More programs mean more awareness of the profession and a greater ability to meet the demands for qualified PAs across the country. We discuss the importance of creating positive experiences and learning opportunities to foster respect and appreciation for PAs, ultimately benefiting patient care. Emerging technologies like 3D imaging and AI may hold great promise in the future of pathology. Marissa was cautious about AI, but acknowledged the potential benefits of technology as a tool to enhance learning and efficiency. Future developments could further integrate these technologies, acting as tutors or assistants to help streamline processes. We emphasize the importance of advocacy and volunteering to continue to advance the PA profession. By engaging and contributing to the growth and recognition of PAs, we can shape the future of the field. We also highlighted the value of shadowing and gaining hands-on experience for new students, which are crucial for getting a sense of what the field is really like. The role of the PA is becoming more important than ever. It requires adaptability, a commitment to learning, and ongoing advocacy for the profession. It's an exciting time for PAs as we continue to carve out crucial roles that improve patient care. As always, I'll have links in the show notes to everything that we talked about today. Don't forget you can follow this show at People of Path on Twitter and Instagram, or just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening, I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.